Global healthcare costs the planet trillions of dollars. Some of the biggest threats facing the global public health can also be the most costly and impactful in the modern age. Climate change, one of the identified threats, can no longer be classified as solely an environmental, scientific, or technological issue. It is the greatest global health threat of the 21st century. It has increased the incidence of infectious diseases throughout the world. Physicians for Social Responsibility notes insect-borne diseases are spreading to areas previously unaffected due to climate change. It adds that climate change also creates potentially deadly heat waves and decreases air quality. Obesity, again, is another significant global health threat, with worldwide obesity rates more than doubling since 1980, according to the World Health Organization. It noted that most of the world's population live in nations where carrying excess weight kills more people than malnutrition does. Obesity affects developed and underdeveloped nations. So the World Health Organization notes that obesity can cause numerous health complaints, including cardiovascular diseases, musculoskeletal diseases, cancers, and diabetes. The list is actually endless. Today, on your regular health TV talk show, The Physicians, we'll be discussing top threats to public health in 2023. Be back after this short break. It's another day with The Physicians, where your health is our business. My name is Dr. Martina Agberie, welcoming you to your favorite health TV talk show, The Physicians. Today we'll be discussing top threats to public health in 2023. Again, I'm not alone in the studio. I have with me my regular co-host, very elegant, as usual, Dr.
Memuna Yusuf Kadri. It's always a honor to be here. And of course, you know, on your favorite health TV talk show, your health is our business.
So we're talking about top threats to public health in 2023. And during the intro, I did talk about the climate change.
Yeah. Which is
obesity, yes, which is very important. Maybe we should just zero down to climate change, the effects of climate change on our own nation, our community, our homes, and everywhere. What have you noticed?
The average Nigerian...
Apart from the heat waves that you're getting, what exactly?
The average Nigerian on the street will tell what's our business with climate change. Yeah, of this time, the regular person on the street may not necessarily think climate change has issues to do with threats to, public health issues in 2023. And this is why The Physicians is a platform where we have to educate people on a constant and regular basis. Why? Because climate change issues are not only Nigerian, they are global, and they can cause food insecurity, lead to a lot of poverty, diseases.
There's so much loss of shelter.
Yeah.
Okay, the truth is, I agree with you. It is not. Initially, you talked about the common man saying what is global.
There's
climate change. Yes.
Even global warming and all that.
A public figure in this our country said it one time that it doesn't happen here. That the climate change is something that is foreign. They're just trying to get us
forgetting that the Ukraine-Russia war affected everybody. So you can't sit in one place thinking, no, let's not even to go to the Ukraine-Russia war. Let's just go to the small virus that emanated from Wuhan in China.
COVID.
What happened?
Coronavirus.
COVID-19 happened.
It's actually a threat. It's also a threat.
Exactly. It happened and the whole world shut down. Like, I can boldly say and tell my children and children's children and children's children, like, I was alive when one time the whole world shut down.
And the truth is, when COVID happened, I got to know that 100 years before.
Yeah, the Spanish flu.
The Spanish flu actually,
which were not alive to
so now we have witnessed. I hope it's not every 100 years we begin to have this, because I don't think anything more than COVID should really come.
Those people that experience the Spanish flu will say, this is the worst case scenario. So it comes with indifferent. But the truth is that the average human being on the street should really know what those top threats to public health is. Especially we're in 2023. For Nigerians, there's a whole lot happening. A lot is changing. This is a political year for us, so it's good that we need this on board. So the people, regulators, the people that need to hear, I
totally agree. I know the guests that we have that will be coming with dive more into it, and let people even know that it's even now that we will start experiencing the effects of what COVID caused. Yeah. My dear viewers out there, ensure you are not alone. If you are still alone, just call somebody, call a friend to hook up and join you in watching this program. We'll be back after this short break. Stay tuned. Welcome back. If you have just joined us, you're on to your regular Health TV talk show, The Physicians, where your health is our business. Today we'll be discussing top threats of public health in 2023. And in the studio with me is our regular host, our regular guest rather. Before I call her host, because she's always with us here. She is Dr. Alero Roberts. She is a public health physician and a senior lecturer, College of Medicine, University of Lagos. Dr. Alero, you're welcome to our program.
Thank you. Thank you for still tolerating me back in 2022.
You know, we can't do that. As public health physician, you know, you always read it out for us. Listen, we're talking about global top threats to public health. Maybe we start with, for people to understand, so that they understand where we are going. Let's talk about public health. What is public health? Why do people know about public health?
Because public health is the health of the public. Okay. So anything that, and basically we are nothing without health. No matter how much money you have, no matter how much education, no matter how big a house you live in, or how many cars you drive, if you don't have health, you are nothing. And whatever affects our health, whether individually or collectively, is public health. So public health is not just the doctor's affair, it's not just the nurse's affair. In fact, it's not just the health sector. It's the environment, it's trade, it's climate, it's economy, it's politics, everything that affects health. And we were talking off camera about the social determinants of health. So there are things that affect our health, and we all have to be collectively responsible for that.
So let's go there. So what are the threats? What are the threats of public health?
Now, you asked me that question, and I had a good long time thinking about it, and I said, no, I'm not going the disease route this time.
Good.
There are real threats to public health in 2023, and I am going to go with climate change.
Good. Okay.
I've got my top 5. You can ask me for a top 10, you can ask me for a top 15, but you asked me for a top 5, so let's stick with the top 5. I'm going to go with climate health. I'm going to go with pandemic non-preparedness.
Okay.
I'm going to go with plastic waste and our food security.
Good.
I'm going to go with other health securities and access to care, to healthcare. That's become a real trending thing, even locally in our country. And I'm going to go with number 5. Guess what? Broken promises.
Okay, that is actually, I think that should be number 1 really. Broken promises.
I thought about it. Because that broken promises breaks down into so many other things, you know. But I think, and that's not just a local thing. That's a global, continental, regional, and local thing. Broken promises.
Okay, so you go through those ones, and we end with the broken promises, right?
Right.
Okay. No, I think we should come up with broken promises because
do we have effect on mental health?
Do you understand?
You understand?
Dr. Alero, let's start with broken promises because it's good for people to even know what are these promises that are broken. What are these things that we should really look about that? Because in Nigeria now, this is our political year. Regulators, government officials, we keep breaking promises, and we are trying to domicile it in our country. So let people be aware of what should empower them to take that mandate to say, we have to do this, you are in this position, do this, and then so many things that are hidden.
And the effects of broken promises.
That is where it is.
That once upon a time, we had a federal minister of health, Professor Lambo.
Okay. Yes.
Do you remember him?
Yeah.
Oh my goodness me. And everybody was quarreling and fighting, oh, he's not a physician, blah, blah, blah. To my mind, in this century, he's probably been the best Federal Minister of Health that we have had. You know what he did? He got us every single policy
in place.
That is what
that
we're
we're
using
using
now.
till today. That we needed and we are using. He got them all written down. He got them all with task analysis. You remember that thing they were teaching us?
Yes,
in community?
yeah.
With all the task activities, task analysis, gap analysis, he got everything and he wrote it all down. Unfortunately, there's a saying, if you want to hide something from a black man, what do?
But you need a book.
You put them all in books.
Oof.
Nobody's reading.
Nobody's reading.
And
But they are
implementing.
there. And the president of the day signed everything off. It was all accepted and signed everything off. It went to Fed, came back, and everything is there, remaining just the implementation and execution. Every single thing. So let's just take one promise, because I know that's what we're going to go with. Let us just take access to primary health care. Now, when I say primary health care, I'm not talking PHC in terms of there's an agency or in terms of there's... I'm talking the first point of care that you can access once you leave your medicine cabinet or your first aid box. The thing has gone beyond your first aid box. Where can you go? Do you remember that during COVID we had this thing and I kept saying, find your primary care provider and put him or her on speed dial on your phone. Do you remember?
Very well.
Till today, there are some people who are still saying, they'll call me in the middle of the night. What do you want me to do in the middle of the night? That this and this and this has happened.
You're a doctor, so you should wake up when they...
When I wake up, what do I do? Where can I go? Who can I call? And I'm sad to say, nobody. I don't know. Because when I say, call so-and Dr. So-and-so, call Mrs. So-and-so, call the chief nursing officer so-and-so, they're not available. And when I say not available, it can be as simple as, look at broken promises. Do you know that we had a team on the duty roster, almost 20 people who are supposed to be on a particular shift for a particular duty roster. 3 people were able to get to work.
Are you serious?
17 others?
No money for transport. Is that not a broken promise?
It is.
Because you now have promised that the people that if you get to this facility,
you'll be able
to access care. If you get to this facility and you've paid your health insurance, you should be able to access care. How do you access care from the air? Who takes your blood pressure?
Exactly.
Who does your temperature? Who even records that, you came in at so-and-so, such and such a time?
The records,
That's ever before you even get to the actual healthcare provider. And this has been going on for years under broken promises. I mean, with the broken promises, we're talking labor shortages. With the broken promises, we're talking the economic crisis. With the broken promises, we're talking the lack of political commitment. With the broken promises, we're talking about the disruptions. People forget. There is nothing in the health sector. Hardly anything in the health sector that we manufacture locally.
Right.
COVID-19, we started manufacturing. Suddenly we saw the importance of manufacturing some of the basic consumables that we need in the health sector. But should, God forbid, we run out of painkillers.
That is horrible.
Painkillers.
I don't even want to think about it.
Before we've even gone to the more exotic drugs, let's talk about painkillers.
Which we use
we used to manufacture before, so what happened?
Oh, yes!
What happened?
We were on the route to becoming a vaccine production country. And the man who was at the forefront of that, may God bless him. So thank you very much, sir. Great teacher, I salute. He's still alive. Broken promises. So there you go. Now we're looking at a situation, because if you say, okay, but it doesn't resonate with me because I am quite healthy. Now we're hearing news of singers and music makers and entertainers
dropping dead
on stage.
Yeah.
Young men supposedly in the peak of their health. And the first question, my husband and I looked at each other and said, what was their blood pressure?
You're right.
What was their blood pressure?
Yeah.
If you are black and you are a man, you are at high risk of essential hypertension. That is hypertension that has no cause.
Idiopathic.
Thank you. I forgot that word.
Idiopathic.
Thank you.
You know, because we want to just try to make it not medical.
Because
the people out here, essential.
Cause unknown.
Because unknown.
You are a man. Essential.
And because you are black and you are a man, you are likely going to be Nigerian.
Thank you. 1 in 4.
1 in 4.
1 in 4. Thank you very much.
True.
You understand?
Yeah.
So, what's your blood pressure?
Yeah.
Okay. Number 1, do you even know you should check it? No. Can you get to have it checked? Once it's checked, who's going to manage it for you? How do you incorporate care of your blood pressure into your normal everyday life so that it doesn't disrupt your life and, more importantly, doesn't disrupt the life of your family?
So rather than buying that bottle of that drink, you know what that drink we're talking about.
Thank you very much.
Give yourself that BP monitor.
Thank you.
Let it be a substitute. Let it be a
So
substitute.
that's number 1.
I don't think many people actually do monitor their blood pressure at home.
Again, we're talking broken promises. And let me tell you where that promise was broken. You know where that promise was broken? Basic primary education. All the things we know before we got to medical school, that somehow we incorporated into our medical training, but we knew it before we got to medical school. We learned where? In primary school. We remember that one teacher you had who was always inspecting
your nails.
Yes.
And
the nails are,
thank you.
You make sure
you did this so that they don't see it.
You knew to keep your nails clean,
your hair
tight, simple things that are inculcated in
personal hygiene.
Personal hygiene. How can we be talking about hand washing in 2020? Teaching people to wash hands in 2020.
At least
for COVID.
Adults.
20 seconds.
Yes.
Let us be adults.
Thank you for the
And we were all learning.
And we were all having to relearn what many of us learned on our mother's knees. Before you came, have you washed your hands before you came to table to eat?
Yeah.
Have you washed your hands before you went into the kitchen to help mommy? Have you washed your hands?
The parents also remember to do that. Do they still remember to do that?
No, they don't.
I want, because this broken promise is very good, I also want Nigerians, because when we talk of climate change, educated people
who say that there's no such
climate, there's no such thing.
Yes.
I want us to nip it on board.
It was actually very
because again,
ignorance. I don't understand.
Primary education.
Do you think it was actually ignorance or the person was just trying to...
Me,
I don't
the
know.
last geography I learned in school was primary 5. By primary 6, I was focused on science. But I learned enough geography to know
the impact.
that climate does not respect borders
At all.
or governments or who is president or who is not president. Climate is climate and it affects us
Everybody.
all. So now let us look at this. Have you been hearing about Cyclone Freddy?
Yeah.
Oh, where is Cyclone Freddy? Now, when tomorrow you cannot get nutmeg, you cannot get vanilla puff. Nobody will remember that Cyclone Freddy, the 3rd major cyclone, has devastated Mozambique, an African country. Rising sea levels.
Exactly.
Migration. Economic refugees.
Diseases.
Waterborne.
Yeah.
And people, I teach this.
Food
Waterborne
insecurity.
diseases.
Food insecurity.
Food insecurity.
Mortality rate.
Thank you.
Morbidity.
Morbidity. And now, with their health system out, they are going to get foreign aid. Okay? Which means that there's going to be a lot of foreign money in Mozambique. And they are going to say, we need doctors and nurses.
Where are they?
They are coming from Nigeria.
Do we still have here?
We have enough. We are still training.
No. How many people?
That is a discussion for
That's a discussion for another day.
Broken promise. You see how disparate and wide this thing can go. You are right, Dr. Memuna. We can start and end this entire program of just that.
Because right there is a big, and it's good for us to nip that on board, because when we say climate change, we are not saying it's a Weibo thing.
No, we're not.
This food insecurity thing we are discussing, it's a major...
Even the way we even treat our environment, the trees, the plants.
Deforestation without me, afforestation. Cutting things down anyhow.
We are looking at it locally, which we should be looking at, because with that, we're now looking at plastic waste. Now you add plastic waste to that whole thing, you don't realize how much you are impacting both the, I mean, where are the geographers? They ought to be here, climatologists.
Yeah.
There are so many. There are so many. This is their area of passion and pain.
Yeah.
This is their area of passion and pain, because by the time they now start breaking it down to you, to the microclimate in your household, to the climate in your environment, before we even talk of Lagos-wide, before we even talk of Southwest Nigeria, before we even talk of the country.
Talk about the climate in relationship to health.
Yes.
Because it's a big issue.
It's a very big issue.
And we shouldn't look at it differently.
Insight.
Yeah, they have. They have.
So many of them have even left our shores and are sharing their research, their wealth of experience and research.
No, Dr. Alero, but that is a dividend of bad governance, corruption, making us lose our talent.
Still goes to broken promises.
It still goes to
So this is a vicious circle.
Yes. It is a vicious circle. So for how long do we, as Nigerians, want to be promised? And even, you talk to the average Nigerian, and, I keep telling my friends, I'm not in the elite class. I may have been born into the elite class. I have no regrets about that. But my work is among what we call the bottom of the pyramid.
The community.
Is right there in the community. If I'm mother and child, I'm not mother and child who has access to a 5-star marble and glass hospital in the most, I'm not.
Exotic area.
You are more in the community and you are just there. So we need to go and keep up with the physicians out there. Let's hear what they have to say about this. So that when we come back, you will tell us more on how we will be able to, even if it's not top there, how we can manage those below, everyone who is down, be able to manage on how to survive these global threats. Dr. Alero, we've talked about broken promises, and it's actually a vicious circle right now. Everything that you have mentioned, that you have discussed, has to do with promises that were not kept. It's not as if we didn't have the policies, we don't have the policies in place, but it's not just been executed or implemented. So now, what are we supposed to do? What do you encourage? What do you advise that should be done? Because we know people out there, everybody is suffering. The climate is no respecter of nobody. Everyone is suffering it.
Everybody's suffering.
So what is your advice? What do you think we should do just this short period?
Do you remember that thing they used to teach us in community health called monitoring and
evaluation?
But that is what individually and collectively we need to be doing.
Like
Number
auditing.
one, you are doing a great job. In the media, you are educating and bringing awareness. Once people know that this is what they are entitled to and this is their right, and we keep bringing these things to everybody's knowledge and awareness, it is their duty to their families to make sure that they monitor and evaluate and see how much they are or are not getting. Okay? So I asked during COVID, is there a primary health care clinic within walking distance of where you stay? Is it open? Is it not open? I put it to my class one day of medical students. This was shortly before the COVID lockdown. And we were talking about this and access to primary health care. And I said, it's weekend, you're going home.
Yeah.
Walk around where you stay and take a picture
Of the primary health care
and let us see what you've got. Then find out who your local representative is and send him or her the picture and ask, why is this like this? It was an eye-opener.
Accountable.
Hold them accountable. And you see, they're not being held accountable by Dr. Mebuna or Dr. Verrier or Dr. Roberts. They're being held accountable by regular Nigerians under the age of 50 who have a long way to go and who are going to need access to that health care.
Exactly.
I said, ask the questions and let us hold our so-called elected representatives accountable.
Let them do what they are supposed to do. Evaluation. Let them do what they are supposed to do.
Let them do what they are supposed to do. And God so good, He has provided us with smartphones, even pure water phones. All phones have cameras.
In those days, they used to talk about the environmental impact assessment. We don't even do any of those things.
No.
We have spillage, oil spillage everywhere.
That is it.
And people just
Before
leave
you
like
get to
normal.
our
Drainages are blocked.
Plastic bags.
Plastic bags.
Anything you buy. I walked into a supermarket. I have taken a decision. I don't use plastic bags anymore. I go into the shop with my own
bag.
A man bought 3 items.
And they gave him back.
And he wanted 4 bags. One should be double bagged. all those bags do what? They end up
in the drainage. And
In
that's why
the
the
drainage.
drainage, that's why recycling is very important.
You know, so we
Yeah.
are going there, and you know, you are not even holding yourself accountable. But when your house floods, you say government. No. It's
What are you
time for
even
us to
putting in your
hold each
drainage
other
accountable?
Yeah. You cannot block the drains and gutters with plastic waste. Now you want to buy a meal. Remember we used to have lunch boxes?
Yeah.
All that is gone. We're using this
Plastic, styrofoam.
Where is it ending up?
Drainages, yeah.
I call it fashion.
It's not fashion.
That's what is killing us.
It's a broken promise.
Yeah, it's a broken promise. Well, I agree with you, Dr. Alero. Unfortunately, time is not always our friend. Before I let you go, just one word to our viewers. One word that you can tell them. Advice. What do you expect them to do?
Please hold your elected representatives accountable. Whoever has come into power after the last election, after the next and last election, remember that this is not just an election period. The next 4 years, every day is an election period for us, the people, particularly as it regards our health. Whatever impacts our health, hold elected representatives accountable.
So you have heard it all, hold elected representatives accountable. We all have to survive. The climate is no respecter of anyone. On this note, I want to call it a day. I say thank you so much for being part of our program, your physicians. Your health will always be our business. My name is Dr. Martina Agbemian. Till next time, stay blessed.
Thank you very much, and please don't forget to follow us on all our various social media platforms, Twitter, Instagram, Facebook, and of course our website is up and running. If you want to be part of this program, just like our lovely Dr. Alero Roberts, just give us a shout out and you'll be right there. And if you've missed any of our previous episodes, our YouTube channel is there. Please go in there and binge and enjoy yourself while getting enlightened. Till next time, remain blessed. My name is Dr. Memuna Yusuf Kadri.